Please help me welcome on stage Tania Douglas.
Good afternoon, Seedstars. The United Nations Sustainable Development Goals include the goal of good health for all at all ages. SDG 3 includes a range of conditions. These include maternal and child mortality, reproductive health, communicable and non-communicable diseases, substance abuse, road traffic accidents, environmental pollution. Technology has the potential to be used and applied to all of these. Technology can be harnessed in the service of SDG 3. We all know this. But can we assume that whenever we apply clever technology, we will automatically get the desired results? Let's look at the example of the play pump. The play pump is a technology that was developed for low-resource countries where access to clean water is a challenge. The play pump is a children's merry-go-round connected to a borehole. When children would play and make the merry-go-round spin, water would be pumped out of the ground into a storage facility. Now, this isn't directly a health technology, but access to clean water is critical for good health. Now, the play pump sounded like a wonderful idea. There were high expectations that it would address the problem of access to clean water. But the reality was slightly different. The play pump was expensive. Conventional hand pumps were cheaper. Installations were funded by philanthropy, so they were not self-sustaining. Maintenance was complex. Water yield was variable because it depended very much on children's play. And of course, there was the risk that children would be injured while playing on the play pump. So, although the play pump is still in use, in very limited use, it didn't live up to all those initial expectations. So what the story of the play pump reminds us of is that technology can have unintended consequences. Now, these consequences can be negative, or they can be positive. So what about the positive consequences of technology? Here's an example. The Microsoft Kinect was initially intended for interactive games on personal computers. It allowed users to interact with their game consoles at a distance. Now, although the Kinect is no longer being manufactured, it spawned a range of applications. One of these applications is to aid in surgical visualization. It enables surgeons to use simple hand gestures to manipulate medical images during surgery. Now, this kind of visualization requires fairly sophisticated technology, and it's really only useful in hospitals that have advanced medical imaging facilities. In many of the emerging countries represented here today, such facilities probably only exist at a few hospitals in major cities, and quite likely, a large part of the population would not have access to these facilities. Unequal access to healthcare is typical in low and middle income countries. This is probably what inspired and motivated many of the health tech entrepreneurs that are present here today. So what about technology that was specifically developed for remote settings? The CardioPad is such an example. The CardioPad was developed by a young engineer in Cameroon, and it's since been deployed in India, Nepal, and Gabon. It enables, or it assists in detecting heart disease in patients who don't have direct access to specialist health facilities. The CardioPad wirelessly transmits patient data via a remote database to a cardiologist who can then make a diagnosis. This image shows that the cardiopad forms part of a network of services and service providers. Another feature of the cardiopad is that it enables task shifting. This means that tasks can be shifted from highly trained specialists, such as cardiologists, who are, of course, in limited supply in remote areas, to healthcare workers with less training in the specialist area. Now, this task shifting and the connections shown in the image don't happen automatically once an innovator has developed a new device. The health workers to whom the tasks are being shifted need to be trained in the use of the technology. The specialist clinicians need to be trained to interact with the technology on the other end of the telecommunications line. The necessary infrastructure needs to be available. The administrators who run the health system need to be willing to integrate the new technology into the health system. So beyond that initial brilliant idea and its development into a product, a lot of work needs to be done to ensure that the technology is implemented. It needs to form part of that ecosystem. If we go back to the play pump, one of the reasons why it failed to meet expectations was that it was erected in isolation. A UNICEF report found that local communities were not adequately consulted, and maintenance was not adequately considered. Another example of a health technology developed specifically for remote areas is a mental health app in use in India. It's called a smart mental health app. Mental health is often neglected, even in high-income countries. In rural areas, there are few mental health professionals, awareness of mental health is poor, and there's stigma attached to seeking help for mental health. The Smart Mental Health app enables health workers to administer a questionnaire to determine if a patient needs to be referred to a doctor. Like the cardiopad, the Smart Mental Health app enables task shifting from a psychiatrist or a psychologist to a trained mental health worker. And like the cardiopad, the Smart Mental Health app needs to be embedded into a supportive ecosystem. So these health apps were developed in response to real needs, and they were able to be embedded into the local health system. So if health tech innovators and entrepreneurs truly want to contribute to reaching SDG 3, they need to be concerned about ensuring that their technologies can find a place in the broader environment. Health technology implementation requires a number of critical factors. Many of these don't exist in emerging countries. Many of them may need to be created. But those of you in the audience who've been selected as outstanding health tech entrepreneurs have an extraordinary opportunity to help create this required enabling ecosystem. You've been recognized, and because of your recognition, you have influence. So here's my call to action. Use this opportunity not only to bring critically needed health technology to patients, use it also to create a new generation of entrepreneurs and innovators. Use it to create structures and systems and institutions that support innovation and entrepreneurship. Engage with your government, with universities, with policymakers. Show them that health technology is not just about disease and devices, but that it's about people and institutions. Use the opportunity to help create a culture that truly supports innovation and entrepreneurship. Thank you.